everyone, I'm Jacqueline and I'm a blogger at GollyLocks.com, and I am here today at Halley Medical Aesthetics Clinic with Dr. Terence Tan, and he is actually going to be here to answer the top 5 questions that have been sent to me about Ultherapy. Ultherapy is one of the treatments that I've done at Halley Medical Aesthetics Clinic recently, and I'm really happy with the results. So, I want Dr. Terence Tan to tell you all the answers that you all want to know. So, Dr. Terence Tan, can you introduce yourself?
Jacqueline, thank you for coming back. I remember we did Ultherapy for you 1 month ago.
Yeah.
And just now, as you saw for yourself, you were super happy with the results. So, thank you for coming back. Hello, hi, I'm Dr. Terence Tan. I'm the doctor at Halley Medical Aesthetics. We are an aesthetics clinic which combines medical aesthetic treatments with the pampering of a spa, and we can address every single issue that most people have in mind, be it wrinkles, pigmentation, pimples, or acne scarring. Very happy to see you guys, and very happy to see you again, Jacqueline.
Okay, so the top 5 questions I've received today are all from ladies, all you ladies out there. So let's get started. The first question is from Janice, and Janice asked, if I'm not happy with the results after I did the therapy, can I do it again after 3 months? Since,
That's the question which we do not normally answer, because most people who come actually have a fantastic result. So Ultherapy is a very good machine, or rather Ultherapy is a very good machine, and the Ultherapy treatment gives very consistently good results. So we don't really get a lot of people coming back saying that they are not satisfied. Just as we showed you your before and after pictures just now in my consultation room, and we showed you how much you have improved when it's only been about a month or so. So you continue to improve in the next 6 months or so.
Okay.
So, but for those people who do want a top up, maybe they feel that they want to have an even better effect, we generally wait till about 6 months, because the treatment, although gives immediate results, but most of the heavy lifting comes after 2 months, and the face continues to improve all the way up to 6 months, whereby you have more and more collagen being stimulated. So generally we ask people, try not to be so trigger happy. You have a look how it is, and at 6 months you can decide again. We can actually do it very, very soon after, but because it continues to improve, normally about 6 months would be good if you really do need to top up.
Okay, so does that mean that we'll save a lot of money because we only need to come every 6 months, or just to...
Okay, I mean, our therapy is as with most very good treatments, is not cheap, but it is good value, because it gives very consistent results.
Okay.
And for most people, we advise them to do it about once a year. So if you divide the cost of our therapy over the 12 months, actually it is not more than any other aesthetic treatment that we routinely do. And in fact, it's cheaper if you think about the fact that you only have to do it once a year. Some people, if they are really happy with the results, they might not even want to come back after 1 year. They might come back after 1.5 years, 2 years. So it really depends. And even then, if it doesn't suit your budget, we can always customize treatments such that we don't do the whole face. Not everybody needs our therapy on the whole face. We can do different parts of the face. We can do the eye bags, we can do the cheeks, we can do the forehead lines or the crow's feet. But generally speaking, most people want to do their eye bags and cheek lifting.
Like me.
Like you.
Like me. Okay, that sounds like a good deal. So let's move on to the second question from Charlotte. Charlotte asked, I have very sensitive skin. Do you think that there will be any adverse reactions if I did Ultherapy?
Okay, Ultherapy is a no downtime treatment. So for most people, after treatment, the patient can actually go back immediately. He can go for parties, or can do sports, can do anything that he or she wants. And that's because it actually the treatment actually cones down ultrasound to a very deep level, up to about 4.5 millimeters. So it really doesn't affect the superficial part of the skin very much. So even for people with very sensitive skin, generally it's okay. But of course, we will tailor our treatment to whatever the patient is sensitive to. And let's say if it's very sensitive to heat, causes rashes, yes, we do tune it down a little bit.
Okay.
But by and large, it's not a big problem, and we can do treatment in almost everybody.
So pretty much anyone can actually do Ultherapy.
That's right.
That's good. Okay, so the next question is by YT. YT asks, can I do Ultherapy if I'm pregnant now? I'm very interested, but I'm 4 months pregnant.
Okay. Generally, when we feel someone's pregnant, I'll put it this way. I mean, there's nothing about Ultherapy which is dangerous for the fetus or for the unborn child. But when one is pregnant, we would actually advise the patient to do it after their pregnancy, because when one is pregnant, one tends to have a little bit of water retention,
Okay.
and one tends to put on a little bit of weight, which is pretty normal. So it kind of changes the shape of the face a little bit. And while that is not a big issue, we probably like to treat a face as is, so that we know where to target, and we know what we need to do to give the best possible lift. And besides, being pregnant is a big event by itself.
Yes.
We probably don't want to take away some of that excitement that the pregnant mother has. So we probably want to skip our therapy until after pregnancy. But there's nothing really dangerous about doing our therapy during pregnancy. But we tell people, come back when you're ready.
Okay, so aside from pregnancy, are there any contraindications that, I can't do Ultherapy when, I'm on certain medication, or is there?
There is actually no strict contraindication against Ultherapy itself, except if, as you had said, the skin is really, really sensitive, and really the patient had done Ultherapy before and really had a little bit of more swelling than we had anticipated. Then maybe we might do other things to firm up the skin. We've got a whole host of machines here, and if we can't do Ultherapy, there are other things that we can do. But by and large, about more than 99% of people are suitable for Ultherapy, and it's good because there's no downtime. So.
Okay. And the fourth question is by Shu Yuan. She's asked, how frequent do I need to go back to do the treatment, which we've covered just now, but what is the most advisable, period of time for, a general person to come back for a treatment again?
Generally, we ask them to come back about once a year. This is not a strict guideline, because actually the effects of Ultherapy is very, very long-lasting. In fact, some say that it can also be permanent. An example would be if we have a haircut, which I've done before, the hair which drops off is permanently gone. But of course, we still have to go back to do a little trimming every now and then, because we do have more hair which grows, and similarly, as we age, we probably need to have a little bit of touch-up as well. So we recommend once a year, but this is not a strict timeline. It really depends on how much effect the patient wants.
Okay, so the last question is by Anonymous. Can it replace a surgical facelift?
No, it can't replace a surgical facelift, and we don't expect it. Most people who come don't expect it to replace a surgical facelift. It is a convenient treatment, it's a quick treatment, it's a no downtime treatment, it's consistent results, it's good results, but it is not a surgical facelift. A surgical facelift has got fantastic results, but together with the fantastic results, it also comes with certain other inconveniences, and therefore it really is a different treatment, and basically both can complement each other.
Okay.
Yeah. And it's good. Ultherapy is actually good for women or men who do want to have lifting, do not want to have downtime, do not want to have surgery, wants consistent results, but don't mind coming every year or every 2 years for treatment.
Okay. All right, so that's all of the questions that we have for today, the top 5 questions. And thank you, Dr. Terence Tan, for taking the time and answering all the questions that you ladies have asked me. So if you have any more doubts or inquiries about Ultherapy, feel free to call Halley Medical Aesthetics today and get your consultation with Dr. Terence Tan. So thank you again, Dr. Terence Tan.
Thank you, Jacqueline, for coming.
Thank you.
And thank you, everyone. See you. Bye-bye.
Bye-bye.